PhD talk show. Today we have with us Kirsty Smitten, who is founder and CEO of Metallobio. Welcome, Kirsty, to the show.
Hiya, I'm Kirsty, CEO of Metallobio, a University of Sheffield spin-out company developing a novel antimicrobial class.
Thanks a lot for being guest on our show. Today we'll be discussing something which is not related to education or job. It is more related to health. Recently, we get to know that you were diagnosed with rare cancer. Would you like to share more about it and how you are coping up with it?
Yeah, so in November, I went into hospital because I was having major chest pain. I could feel it in my heart. Prior to that, I didn't really have any other health issues. So I was playing sport every day. I was probably what I would consider in the fittest I'd been in a long time. It was just the pain. So we went into A&E, and because of how I was and like how my ops were, the GP in A&E actually thought I'd just pulled a muscle. So his advice was to go home, to take codeine and go home. My mom argued that she wanted me to have a chest X-ray and blood tests, and the chest X-ray found that my heart was enlarged. So we had a CT scan, and they found a 6 centimeter tumor in my heart. It's taken 7 scans, 13 or 12 or 13 blood tests, and a biopsy, and then major heart surgery, and 3 months to diagnose me. And I was diagnosed with right atrial primary cardiac angiosarcoma, which is an incredibly rare and aggressive form of heart cancer. It typically affects less than 1 in 20 million people. So it's one of the rarest types of cancer that you can get. How I'm coping with it, it's a bit up and down. So I think I looked into to do whatever everyone would do. I looked on Google and looked at papers and realized that the life expectancy of someone with this cancer is on average 7 months. Only 10% of people make it past 5 years, and those people have had an operation. I was considered inoperable, so the likelihood of me even making it past this year was very, very slim. So I think it was difficult. I just lost my dad 4 weeks prior to me going into hospital. So mentally, it's been a battle, but I'm trying to remain positive. I've read a lot around the cancer, looked into current research, and basically seen that there are options. And I think I do have hope. I am quite positive. And even if I don't get a lifetime, I think I will get more than 7 months. And I want to use that time to basically try and improve treatment for, diagnosis and treatment for cardiac angiosarcoma patients. So because it's so rare, basically the life expectancy hasn't really changed in 30 years. If you think of other cancers, you can live with stage 4 cancer for a lot of other cancers for a full life sometimes, like you could, because the cancer goes into a chronic state. So things need to change for rare cancers, and I kind of want to use the time I have to help make that change.
Yeah, it's scary, and at this age and at this career stage, I think it's a lot. And when you know that there are not many options you have, best wishes from our side. And what was your first reaction when you get to know that you had this rare disease?
Yeah, so obviously I was diagnosed at the start of February, officially diagnosed at the start of February. But knowing a bit about cancer research anyway, after I spoke to my doctor about my MRI, which was done in November, we kind of had an idea then that this was what it was going to be. So the mass was very irregular. It was taking up a lot of the dyes in all the scans that I was having, especially the PET scan. So it accumulated a significant amount of PET dye. So we kind of knew. So I think I had a couple of months before the diagnosis to come to terms with what was going on, but I was scared. And I'm in I'd say like a really good place in my career. I'm 28 years old. I wanted to have a family, and that's all been taken away from me. And even if I do get through it, the family part's been taken away. So I had to have chemo straight away as soon as we realized what it was. So I didn't have the time to have my eggs harvested. We couldn't afford to wait, which means most likely I'm going to lose my fertility, which is quite a big deal to me. So I think not only has it taken away my health, it's taken away my future, it's impacting my career. So we are taking on investment at the moment, and investors are, as much as they don't want to be, investors are worried that I'm not going to be in the company, potentially not going to be in the company anymore, and it is impacting work. And it's such a shame because our business was doing really well, it was really promising, and it's a shame that that potentially could be impacted just by my health. So I think it's difficult to cope with because there's so much that it affects, but then there's also a lot of things that I think it kind of has put into perspective for me. So I used to work all day, then I would go and play football for an hour or two, and then I'd work again, and that was my life in the week. And I didn't ever have any time to relax or just sit. And I think this has given me time to just stop, and I'm like, I was working too much. So I think there are benefits of it, but I think the main thing when I first found out was you kind of get sucked into looking on. Not, I wouldn't necessarily go to Google because of a science background, I'd look at papers, but you get sucked into looking at all the research, and you can kind of get into this hole of just reading and reading and reading. And then, like, I don't think that's the best thing to do, because you have to think, whilst they are the general statistics, everyone is different. So with my cancer, typically when it's found, it's spread, it's so aggressive and it's asymptomatic in the heart that when they do find it, it's usually spread, and it's usually in the lungs, the bones and the brain, whereas mine hasn't. So I'm in a lot better position than quite a lot of the people that are in those papers that I would read. So I think if I had any advice for anyone that was getting diagnosed, it would be, don't read everything. I would read things, and I would read scientific journals, make sure they're from the right place. I wouldn't read things on Google because it's not the best place for actual scientific work. But I think communicating what you read with your oncologist is key, because you need to make sure you have an understanding of what you're reading before you start to read everything and get into a depressed state.
Yeah, I think you touched upon very important thing. Whenever like we got diagnosed with any disease, first thing we do is either look for it on Google or YouTube, and just like get more scared by things which we saw. And I think science communication is something which should be improved in a way that there should be platforms where people could communicate with people and try to help patients understand exactly how each patient is different. I think that's the main
Yeah.
thing. So we cannot like just go with what's for general public. So so had you considered second opinion, because it is something people do consider in cancer or such diseases?
Yeah, so for me, that would probably be my 100% main piece of advice, is get a second opinion. Even if your prognosis was good, I would still get that second opinion. So for me, my cancer is so rare. My surgeon has never operated on one, and my oncologist has never treated it. No one at Birmingham Teaching Hospitals has ever treated it, which means there's a lack of understanding now. I don't have any problems with what my oncologist's done in terms of my treatment plan. But the operation is key in my cancer. It's the only way that you can give yourself years. And I was just deemed inoperable without an explanation as to why I was inoperable. So what we did was I basically looked at the best people globally for this cancer. So we were and potentially still are considering going to America for a surgery. But I also looked in the UK, and there was one guy that stood out and was quite pioneering in clinical trials for angiosarcoma or sarcoma. He heads the sarcoma unit at the Royal Marsden. And we asked for a second opinion from him. So I think with something so rare, you need to be under a specialist, under someone that's treated it before, that knows the cancer, that knows what it typically does, the best treatments and new treatments. So we asked for a second opinion from him, and they phoned me last week. And under them, my scans in November, they probably would have put me on preoperative chemotherapy. So I would have been a candidate for surgery. So they're glad that I'm on systemic treatment. They're glad that I'm on chemotherapy, because obviously that's getting a handle on the cancer and stopping it from spreading. but we are now Reading, but we are now hopefully, depending on what my scan that I had today looks like, looking at a surgery in the UK, which has changed from I have 7 months to live to I could have 2 years, potentially even 5 years. And then if you think how much cancer treatment's coming along, especially over the last couple of years, and the likes of mRNA vaccine coming out soon and the CAR T therapy, 2 years to 5 years is potentially enough time for something new to come out where I could then have an actual life. So it's that second opinion's changed my life, basically. I said that when they phoned me, and I was nearly on the verge of tears because it's like I now have hope. I had hope before because you've always got to have a bit of hope, but now that's kind of solidified that I have more hope now. And I think getting a second opinion from someone that is a specialist in the field it's potentially life changing, because that's added years to my life expectancy.
Yeah, I think second opinion is very, very important and it does change things for many patients. As you mentioned that it is rare and aggressive cancer. Do you think like there are options to get screened yourself before it is too late?
Yeah, so the problem with it, with rare cancers or rare diseases in general, is because there's such a lack of understanding. The diagnosis is really difficult. So if you take the fact that I presented into A&E with chest pain, that I was playing football and hockey every day, sometimes twice a day prior to that. My SATs were 100%, my heart function was 100%. You can understand why they're not going to automatically think, oh, this girl has a heart cancer that only affects 1 in 20 million people, because I otherwise was healthy. So I think we did every test we could do, but with angiosarcoma, there are certain things you can see on the MRIs and certain things when you read around that you can see radiography wise that would look that way. And then I think getting the biopsy early on when it's suspected is really, really key, because you can do genetic testing on the biopsy, which opens up a lot more potential treatment options. So typically for angiosarcoma in the heart, the options are surgery, paclitaxel, deoxyribosine and isofamide, and then radiotherapy, and then that's it. But with your radiotherapy, because it's in your heart and your heart beats, you can only dose with such low doses because of toxicity that it doesn't really do anything. Potentially stabilizes for a little bit, but it's not going to give you a lot of time. So the options are so minimal that I think that genetic testing should be routine. It should be done because it opens up chances for immunotherapy. It is done in America routinely. It's just not done in the UK routinely for angiosarcoma. So what I'm hoping, and I've been speaking to a woman whose husband has the same cancer, we're hoping that we can work together with Sarcoma UK to try and get that put on the NHS to get a code, and that would mean that people would have more options. Also, there's specific mutations that typically present in cardiac angiosarcomas. There's a gene called TP53, and there's usually a mutation in that gene. So I think you could screen for that mutation earlier on. So I think it's getting that diagnosis time down, I think would improve the prognosis, because it's so aggressive. I haven't had a scan for 3 months. We might be actually in a completely different situation to what we think. So at the moment, we think I have no metastasis and my tumor is very confined in the cavity of the right atrium. But in 3 months, potentially that's changed. And I think that diagnosis time needs to be cut shorter to improve the prognosis. And then also the genetic testing needs to be done to give that treatment option with the immunotherapy. So I think these are things that need to move forward, but then you have to take into account, when it only happens in less than 1 in 20 million people, who's going to fund that? Working in biotech, like I've tried to explain to my mom's like, cancer treatments have come on so much. I'm like, yeah, they have, but no one wants to fund a drug that only 1 in 20 million people are going to take, because there's no money in it for them. And that's unfortunately the case, and it shouldn't be, but it is. So I think it's getting that changed as well, which really needs to come from the government, because it's not going to be funded by investment. Investors won't want to fund something where there's no return for them. So I think it's getting those sorts of things changed. But the problem is patients like me don't have enough time to make those changes because we've got such a short prognosis. So I'm hoping that I can. Like, I've got some other podcasts lined up, one with the BBC, and I think hopefully if I make a lot of noise about this, I can make some changes, and that's my aim.
I think definitely, I think people should listen to your voice. And this is something like no one wants in their life, to get diagnosed with something for which you don't have drugs, or for which no one wants to invest to find treatment. But I'm hopeful that things will change in future, and definitely there'll be more options. I know like it is very devastating, both career wise as well as health wise. So what you are doing to cope up with mental health as well as physical health while going through chemotherapy?
Yeah, I think that's where I probably have one done well and one not so much. So in terms of the physical battle, I'm still exercising, I'm still eating well, I've got the physical part there, but the mental part, um, I think I am speaking to. So the good thing is that if you speak to Macmillan in the UK, you can get 6 sessions of counselling through Bupa, and that's done for free. So I've got that coming up, and I think that will help. But the problem is, obviously, with my dad recently passing away, it's like trying to deal with two things at the same time is quite difficult. What I would usually do when I do have stressful problems, or I do have maybe a bit of depression, is turn to sport. So I usually play football to kind of take my mind off that, and that's just been taken away from me now, so I can't play football either. So I think potentially looking into something like yoga, or like mindfulness. So I've been trying to do breathing with mindfulness, but it's those kind of types of things. So I think the main trigger, I think, is anxiety for me. So before a scan, I typically end up having a panic attack, and I've never had panic attacks in my life. So they just started as soon as this happened, and it's just that fear. And people that have cancer call it scan anxiety, where they get the phobia before they have a scan. And I think it's getting a control of that, which again, my GP's recommended breathing if I feel like a panic attack's coming on, because I'm aware that that's what's happening, but it still happens because it's just a fear, I guess, of the unknown. Like, I'm quite used to being an organized person and someone that knows exactly what I'm doing and like have a plan, and I can't plan now. And I think that's the thing that I'm struggling with the most, because I can't look to the future until I know that there's potentially a future there. I think, yeah, I know the hospital offer other things around mental health. It's just I haven't really tapped into them yet. It's been a lot to process.
Yeah, I think like you are very, very strong and you are extraordinary. Like a normal person like us, it's very difficult to cope up with all these things happening, particularly like taking care of everything. And when you don't have like whole lot of support, be it at your startup, which is doing great, and I'm sure like investors will be more interested in investing in your startup, as well as consider that you are doing things which other people might have stopped doing when they face such things, which other people might have stopped doing when they face such issues. Before we wrap up, one message for people, be at any career stage, who face such difficult time, what they should do before moving on to the things in their life.
I think if you face something like this or something difficult, I think stopping and seeing if working is something that you still want to continue doing. So I think that's kind of one takeaway. Is like, when I got faced with cancer, we had an emergency board meeting and we discussed whether I would continue to work. It was a mixed opinion. Like, some people thought I should focus on my health. I personally know my mental health will suffer if I'm not working, because it's my getaway. So I really enjoy my job. I love what I do. I want to help people, and I think that builds me up, and I think I have something to get out of bed for every day. So I think I chose to work, but I don't feel like you should be pressured to feel like you have to work. If you don't think that you can work alongside having the cancer or alongside facing a health problem, I think take that time and step back, because the people around you will support you. So my company and my team offered that support, so I could have just stopped working and they would have carried on. They would have all put more time in, and that support was there. It was my decision to continue. So I think it's taking a step back and assessing what's going to be the best things in your life to continue for you to have the best like mental outlook to face what you're going through.
Yeah, thanks a lot. Thanks a lot for sharing about your health and how you are coping with it. And I'm hopeful, like people who will watch this video, definitely they'll come forward and support you in whatever you are doing, as well as if they could help you in finding better treatment options. And I'm hopeful investors will definitely consider everything you are going through before making any decision. And best of luck for your startup. And we are definitely hopeful that you will bring more treatments related to antimicrobial resistance treatment, which is again a different avenue which like you are taking care. Thanks a lot once again.
Thank you.